Labor has ripped the heart out of the NDIS, and people in my electorate are paying the cost. They tell me that these changes are a betrayal of them by the Labor government. When the government chose to slash so much funding from the NDIS to add insult to injury, they also made it harder to access the NDIS in the future. A thinly veiled attempt to remove support for people or to remove them from the NDIS altogether, and they've succeeded. And let's be clear here, these services are essential, absolutely critical to keeping people well, in many cases to keep them alive, to live a meaningful life. NDIS providers and the participants using their services in my electorate of Ryan tell me the same thing. These changes mean that the providers are no longer able to provide the services that the participants and our communities desperately need. The providers are being forced to close their doors. Just this month, I was contacted by the Archdiocese of Brisbane to inform me that they've been forced to make the heart-wrenching decision to withdraw from the delivery of NDIS-funded disability services through their social services agency, Centrecare, precisely because of the new NDIS funding model. The closure of Centrecare's disability services is going to directly impact 698 people with a disability and approximately 630 staff across South East Queensland. And in my electorate of Ryan, it's 40 clients and 16 staff directly impacted by the gutting of the NDIS. And now the Labor government is gutting it further by removing children with mild autism from NDIS support in another cruel and callous move to save money. Autistic Australians deserve support from our government, not the opposite, not having the rug pulled out from under them. Terms like mild and moderate autism have absolutely no clinical basis. The minister has fabricated this. These terms are harmful and further isolate children in need of support. I've had very many parents of neurodivergent kids reach out to my office since the announcement in deep distress, terrified that their kids will be left behind. It's clear the government, in designing this policy, didn't consult with experts in the space, nor indeed with those who would actually be affected. The design does nothing more than attempt to solve a political problem for them. Neurodivergent kids and their parents being used as political footballs. That's shameful. The proposal is that these kids will be kicked off the NDIS and shunted to a Thriving Kids program, but for affected kids and their parents there is staggeringly little information about this, further exacerbating their worry and their distress. For instance, there is no information in the Thriving Kids program that provides guidance as to what happens with children currently on the Early Childhood Intervention program who would have transitioned to NDIS prior to 2027. There is no information about whether critical services such as speech therapy and occupational therapy would be funded under the Thriving Kids program and with the providers who have been working with these children for a significant period of time. There is no information about how children will access these therapies and what the threshold criteria would be. These cost-cutting measures are indescribably cruel and are deliberately targeting vulnerable Australians. That is unconscionable. Australians deserve better than to be treated like a line on a spreadsheet.